What about serotonin genetics? This study looked at serotonin genetics and found no association between serotonin genes or genetics and depression, and also, perhaps more importantly, no correlation between genotype, stress, and depression. Now, why this matters is there's this debate of genes or genotype versus phenotype, hardware versus software, if you will, and also the observation that some people will flare upon stress. They may notice they become depressed. They may notice that their IBS flares and they have, let's say, diarrhea, abdominal discomfort, and depression when, again, they're hit with stress. So it begs the question, could there be something from a hardware or from a genetic perspective that predisposes these individuals to depression? And again, the answer here seems to be no. However, there is a silver lining to this finding in that the sensitivity to stress may more so be on the phenotypical level, meaning it's the software. So if someone's had traumatic events, this can skew the software and lead one to be more sensitive to stress. And this is where at the clinic we found certain techniques, most namely the Gupta limbic retraining program from Ashok Gupta, who's also been on the podcast, and he's published to date 2 clinical trials, to be helpful in allowing patients who notice a stress aversion to then go through some therapy and be able to better tolerate stress. So it's not on the gene level, it's at least seemingly so from partially my inference on the phenotypical level, but that's helpful because you can't really change your genes, but you can change either your phenotype or the software, so to speak.